Yes, good afternoon, everyone. Hope NORCET fever is quite coming, right? So just chill, children. Just chill. We are going to face the exam and in a positive manner. Hope because we have learnt everything, right? You have learnt everything. Just you need the guidance and how you are going to approach the exam. Just be chill, calm, reduce your anxiety. Okay, revise some important points, go through the MCQs, whatever you have learned, and don't learn anything new now because it won't help you. Okay, if related concept, you can clear your doubts. Okay, that's it. Now I came up with one important subjects, that is pediatrics, which is very high yield, important in our NORCET aspect. Okay, yes. Before that, let me confirm whether my audio is clear and video is visible. You just confirm that and we will go to this session. Okay, yes. So today's session will be like important MCQs, like 50 plus MCQs like yesterday. Within 2 hours, or we are going to complete the MCQs. It will be like quite fast because it is revision. We have to cover lot of points. Yesterday's session, students were commenting that it is fast and I was just hiding the questions. It's not like that. I was explaining. Today, I will manage the board as well as the MCQ part in a slow and precise manner. Okay. Yes, it is clear. Thank you. Thank you so much for your support. Welcome, welcome, Shilpa, Negi, Vel Murugan. Yes, yes. Okay, let's start the session. The first question will be from this side. Okay, yes. What is the maximum weight in grams they are given? KMC, Kangaroo Mother Care, is generally recommended. Okay, now tell me which will be the answer, whether it is 1500 gram, it is 2000 gram, it is 2500 gram or 3000 gram. Now tell me this question, answer. So you are all going to answer most of the questions. Okay, it will revamp your knowledge as well as what are the contents you have studied. It will help you. Okay, yes. Now tell me the answer. No, 2500. It is 2000 grams, 2 kg we will recommend. Now tell me, what is IKMC? Okay, IKMC means what? Now tell me. No, it is not A, it is 2000 gram. I will repeat, 2000 gram, it is the recommended weight. 2000, that is 2000 gram is 2 kg, is the recommended weight for proceeding Kangaroo Mother Care. Okay, yes. What is IKMC? That is the question here. Very good evening, Sapna, Rajput. Yes, Devi, Jen, everybody. Bhavana, yes. Sugant, very good evening. Hope you all downloaded your admit card. Please make sure everything you have. Okay, yes. Let me discuss this topic in the end of the session, how you are going to take care of your admit card and everything. Okay, yes. Yes, immediate, not it is, somebody will tell intermediate. It is immediate Kangaroo Mother Care. Okay, we have to initiate to induce what? Bonding between the mother and child. We are going to do that Kangaroo Mother Care. There are a lot of benefits, but just remember, don't confuse with IKMC. Lot of students were reporting. Yes, okay. Next question. The answer is B. Yes. Now tell me, child with nephrotic syndrome is receiving corticosteroid therapy. What should the nurse closely monitor for? Yesterday, I have told corticosteroid, this steroids as a property to hold sodium and another electrolyte which will be low. Now tell me that. Yes. Immediate Kangaroo Mother Care, it's correct. Bharat and Bhavana, you are correct. Yes. Now I am not adding the question. I will give time so that please answer quickly. We will. Okay. Yes. Yes. Correct. It is easy, right? Yes. Vitamin D and calcium deficiency is also there, but closely monitor. They are asking close monitor things. So now it is blood glucose levels and signs of infection. Okay. Yes. Correct. Now tell me nephrotic syndrome. Nephrotic. What will be the primary symptom, and nephritic? Nephrotic, there will be proteinuria will be there, right? Proteinuria will be there. And in nephritic, what will be there? Nephritic. So yesterday I told sodium, that is the corticosteroids as a property to hold sodium, so that hypernatremia will be there and loss of calcium, that is potassium, will be losing. Okay, so there will be hypokalemia will be there. Yes, proteinuria. And nephritic, what will be there? Nephritic hematuria will be there. Hematuria will be there. These are some important points you should note. Between difference between most common difference, that is enough. Okay. Yes, inflammation will be there. Yes, correct. Due to inflammation there will be this thing. Okay. Now tell me, I will go this side. How many diseases are prevented by the vaccines included in national immunization schedule in India? Okay. How many diseases? You have to split up and tell. Okay. Please split up and tell. Yes, it is 12. Correct. Okay. Now I will write here 11 diseases plus 1, that is Japanese encephalitis. Okay. Only in the outbreak area, high risk area we are going to give. Okay. Yes, that is 11 plus 1, 12. Yes, correct. Yes, now tell me. Next question. Which type of rashes are characterized seen in measles especially? Okay, measles. Now you are going to answer lot of, now I am going to discuss some points related to measles also. Okay. Now tell me which type of rash will be there. Yes, it is easy, right? Maculopapular rash. Every year they will ask from measles, they will give what? That is Koplik spots they will give. Koplik spots they will give, but this time there is possibility for this question, maculopapular rash. And pleomorphic rash will be seen in which condition? Okay. Yes, come on, tell me. Pleomorphic rash will be seen in? Pleomorphic rash will be seen on? Yes, correct. Okay. Yes, chicken pox. Correct. Yes. Now tell me, in measles we are having Koplik spots, and from which day it is very infectious? Now I am going to discuss that. Before, that is before 7 days and after 7 days. Before the onset of rash and after the onset of rash, 7 days, it is highly infective. Highly infective. And another one thing which is very important in measles, can anyone tell? Okay, it will start from behind the ear. Behind the ear, the rashes starts. Okay, these are some points you should note. Okay, yes. Next question. Which type of rash distribution is typically seen in chicken pox? Chicken pox, they are asking. Yes, cephalocaudal rash. Cephalocaudal is from head to toe. That's what is main, and proximodistal is from the right side to this area, from right to left, that is cephalodistal, that is cephalocaudal. Okay, yes, correct. Centripetal. Centrifugal rash will be seen in smallpox. Centrifugal will be seen in smallpox. Yes. It is centripetal. Okay. Chicken goes with pedal. Okay, just remember, like chicken goes with pedal. Yes, centripetal rash. Now tell me this question. According to IMNCA, that is Integrated Management of Neonatal and Childhood Illness Guidelines, what for oral care in a child with oral thrush candidiasis, they are asking. Outpatient management, what is the management you are going to give for neonates, that is children? Okay, yes. Gentian is an antifungal element. What is the percentage? Maybe this may be your question. Please, 0.25. It is 0.5 percentage. It is 0.5 percentage violet solution we are going to give for oral candidiasis, especially as recommended by IMNCI. Okay, yes. Now tell me, is it clear? That is 0.5 percentage gentian we are going to give as per IMNCI guidelines. Okay, yes. A child diagnosed with pyloric stenosis and is experiencing persistent projectile vomiting. Projectile vomiting seen in which condition? And what is the acid base imbalance? Now you will be able to know this. It is very repeated question. You will be able to answer. But projectile vomiting, they are given a word. Projectile vomiting will be seen in yes, Rapa, good afternoon. Yes, C, correct. But the question is, projectile vomiting will be seen in. Projectile vomiting will be seen in. That is my question. You all know that is metabolic alkalosis. You all know that. Yes. Yes, pyloric stenosis. That's what I was expecting. Thank you so much. Projectile vomiting will be seen in pyloric stenosis, and lot of questions were loaded here. So we are going to grab up every concept. Okay, we are going to discuss in every aspect. We are not going to lose a single question from pediatrics now. Okay, yes. It is metabolic alkalosis. Okay, yes. And another one thing, in vomiting, which electrolyte will be lost? That is always potassium. K plus. Okay, potassium will be lost. I have written here. Okay, yes. Next question. Which of the following is common complication of measles in children? Measles in children. Measles as, what are the complications? Okay, you can tell me that. Otitis media or diarrhea, heart failure. Otitis media, pneumonia and meningitis. Diarrhea, appendicitis and renal failure. Now tell me. Okay. Most common cause of death in measles is due to what? Okay, death in measles, if they ask, that is pneumonia. Okay, pneumonia. Okay, yes. Most common is otitis media. Yes, correct. Otitis media, pneumonia and meningitis is the common complications in measles. Okay, Now tell me mumps. Which is the most common feature and most common complication? Complication in mumps. Yes. Late complication is meningitis. Correct. Late complication. Correct. Now tell me about mumps. Most common feature we can say that is parotid gland enlargement. And most common is dysphagia. Difficulty in swallowing, and one term called difficult pain during swallowing. That is, what is the term called? Odynophagia. Okay, odynophagia will be there. That is most common symptom in mumps. And complication, if you say, that is orchitis. Orchitis and hooferitis. Orchitis in male and hooferitis, inflammation of the, where that is the testis, we can say that is orchitis. Inflammation of the ovary, that is we can say that in female, that is hooferitis. Okay, this is the complication and as a problem in fertility too. Okay, yes, correct. Parotid gland swelling will be there. Yes, correct. Hope you guys revised everything, right? Now here comes the confusing question. Every year they are going to ask this question. I think from NORCET 5 they are focusing on nutrition. Any question will come from nutrition. Either it might be in community or pediatrics. Some questions will come from this chart. Okay, yes. And what is the color coding for male? That is for boys and for girls. Girls loves pink. Boys always like a sky blue. Okay, remember like this. The given growth chart shows height plotted against the height. Okay, height for age. Height for age they are given. This is the age, this is the height they are given, and standard deviation is -2. Height for age -2, it is shunting -2. Again I will repeat, -2. It is, yes, correct. You're all correct that shunting. See, this is the height. Okay, for this age around for 10 or 5, you can see the height should be like this. Okay, what is the height? Height double set. If for example 100 centimeter height, okay, for 4-year child, that is the normal height. If the height is not attained, it is only 80 centimeter or 75 centimeter, then we can consider that is the child is not attained height for his age. Okay, 4-year child should attain 100 centimeter. It is not attained, then it is shunting. So shunt, you can remember like that. Then height for weight and height for age, that is totally different. Don't remember that shunting. Shunting is always height for age. Height for age. Weight for age is there and weight for height is also there. Weight for height. This is the two concepts we will discuss. First, remember that if height for age, this is very important. If you remember this, you can answer this. Only the shunting and that is severely wasted, we can say. Severely shunted, we can say. Okay, wasted comes under weight for age and weight for height. Shunting always comes in weight for age. Height for age, sorry. Height for age -2 or -3. Okay, yes. Is it clear? Yes. Lot of mnemonics are there. You can able to remember that. But first remember the point, height for age. If you remember this, it will be easy. That is shunting. Now tell me this question. The given image shows a newborn. Okay. We will say late newborn and early newborn. Okay, what is the difference in this? This is early newborn, 0 to 7 days. From 7 to 28 days, that is late newborn. Okay, yes. And severe limb malformation, shortened or absent long bone with hands attached close to the shoulders. Okay, based on the deformity shown, which drug exposure during pregnancy is most likely responsible? Okay, what is the term here? Shortened or absent long bone. Okay, this is like quite tricky question, but you just remember the point. They have told that shortened, there is one term called shortened and absent long bone with hands attached. Okay, the trunk is attached towards that. What is the drug? Yes, Pocomilia. You guys learnt everything. Yes. Picomilia. Yes, correct. Thalidomide. Yes. You all know that. Yes. Okay. Yes. Thalidomide. So in this point, this Pocomilia you can see here. Okay. Seal-like limbs. Okay. Seal-like limbs. And this isoretinoin causes craniofacial, cardiac, thymic, CNS malformation. You just remember this point. Isoretinol. And thalidomide, already we have discussed this Pocomilia. And phenytoin causes fetal hydrain syndrome. Okay. Growth deficiency, developmental delay, everything will be there. And craniofacial abnormalities also will be there. Here, this isoretinoin and phenytoin. This is a new term here. Apart from for this question, okay, fetal hydrain syndrome will be there. Okay, yes, yes, correct. 4 Ds of symptoms. We will discuss the malnutrition. I am having a separate slide for you. Okay, I will discuss that point. Please be hold on with this question. Okay, you just remember for weight for age. That is height for age. What I have told, that is shunting. You just remember that point. That is enough. After that, we will discuss in another slide. Okay. Yes. 4 Ds are seen in which condition? It is easy. Pellagra. What are the 4 Ds? What are the 4 Ds? Now tell me. That is dermatitis, diarrhea, dementia, death. Okay, yes, dermatitis, diarrhea, dementia, death. Yes, correct. Pellagra. Pellagra is which vitamin B deficiency? Pellagra is which vitamin B deficiency? Okay. After that, you can answer this question. Which vitamin deficiency? Tryptophan. Yes, correct. Yes, vitamin B3. That is the question I was asking. Like thiamine, vitamin B1, B2, B3. That is B3. Yes, correct. Niacin. Yes, now tell me which instrument is used, that is given below. Yes, Panda here, Yana Jin, Mary Jan. Yes, Rupa. Yes, everyone is correct. Everyone is correct. No, now tell me the answer for this question. Shown in this image. See, fast we have to do because we are having another 40 plus questions. Okay, yes. B2 riboflavin, rapasargam. Yes, good. Vitamin B1, thiamine, B2, everything she have typed. Yes, thank you so much. Thank you so much. Thank you. Now tell me, helix evacuator is the clot removal in the bladder. Okay, clot remover. This is the answer. Yes. Helix evacuator is the instrument used in urology to flush out the blood clots, tissue fragments and other debris from the urine bladder after the procedures. Tomy syringe is used for bladder washout. Okay, large capacity catheter tip will be there. And Foley's catheter, you all know, F indicates the circumference. Okay, Yes. And lever lock syringe is used to create type locker to secure and seal proof needle connection. That is lever lock syringe. It is clear? Yes. Thank you all. Thank you. Thank you. Which of the following is defined as compulsive urge to steal items, usually personal or monetary value? It is something related to mental health nursing. Okay. It might be a question. Yes, kleptomania. Yes, it is kleptomania. Yes. Erotomania involves a belief that someone higher social status and intense need to be center of attention, persistent worry about having serious illness, and frequent intensive thought about the food. Yes, now tell me the answer. A or B? An intensive need to be the center of attention, erotomania. Yes. A belief that someone in higher society with an individual is in love with the individual. Yes, delusion of love, that is erotomania. Which of the following is not included in the criteria of severe acute malnutrition? Not included, they have asked. Not included. This how the tricky question will be. Okay. Yes, just see the word not, never. Okay, not, never, except. Okay. Yes. Weight for height is there or not? It is there. Mid upper arm circumference is there or not? Yes. Height for age, yes, it is there. And weight for height is also there. Pedal edema is there or not? Height for age is there or not? Yes. Height for age is there. Severe acute malnutrition they are asking. It is shunting, chronic malnutrition. Okay, chronic malnutrition, it is there. Okay, now this is the parameter I want you to be clarified about this. Weight for height, acute malnutrition, weight for height. Okay, WH, weight for height. Now upper arm circumference with Shaki tape we will mention, that is also comes under malnutrition. This weight for height also wasting. What is the Z score, standard deviation score? -2 to -3 will be greater than or equal to -3 standard deviation. Severe malnutrition, if they ask, the score is always -3. It is moderate and this is severe acute. Acute severe malnutrition. Okay, like that. Weight for height, acute severe malnutrition. Now come to this point, mid upper arm circumference with Shaki tape. If it is less than minus, that is 12.5 centimeter, we will telling it as malnutrition. Less than 12.5 or greater than 11.5 centimeter. If it is less than 11.5, then it is severe malnutrition, that is to acute severe malnutrition. Okay, acute severe malnutrition. Screenshot can take. It is available in the book. Okay, till now you have not studied this, then okay, this is very very important. I will clear you the doubt. Okay, a severe pedal edema will be there in Kawashiakar. Okay, and we will be having a flag sign too, and severe acute malnutrition. Okay, presence of edema will be there in Kawashiakar. Marasmus, there will be wasting. Okay, yes. Height for age, here comes the point. Height for age, that is shunting. I told chronic malnutrition, shunting. Here Z score is now -2 to -3, that is -2 to -3 standard deviation. If it is more than -3, then it is chronic, that is severe, chronic severe malnutrition. Chronic severe malnutrition, this is chronic moderate malnutrition. This time they might ask -2 SD, like chronic moderate malnutrition or severe malnutrition, you will be having the doubt regarding this. So please correlate and answer. Here comes the point, weight for age. Weight for age, that is underweight, mixed indicator. See, the age is around, what we can say, what is the, we can say with the neonate itself. Okay, weight doubles at 6 months. For example, we can say 3 kg is the newborn weight, so it has to get doubled in 6 months. If the baby does not have the weight 6 months, in the sense we have to have 6 kg, it is around 5 kg, then it is underweight. Okay, if it is 4 or 5, okay, between 4 or 5, then we can say it is chronic malnutrition. That is we can say, you can see height against the age. Okay, height for age. Height for age is -2 standard deviation. -2 standard deviation. It is whether it is shunting. They have not asked about chronic malnutrition or acute malnutrition, underweight or anything. They are asking whether it is wasting or shunting. That is the question here. They are not asked about underweight here. If the underweight is there, okay, weight for age -2 SD, then we can say that is underweight. Then it is underweight. Okay, yes. Video is buffering, please make sure your internet is quite good. Yes. See, if underweight is there, we can say weight for age. Here height for age is there. If height for age is there, we have to choose shunting only. Okay, we have to choose shunting. Is it clear now? Okay, -3 SD, don't confuse between. If it is between -2 and -3, it is moderate malnutrition. Whether it is acute or chronic, that we should analyze. Okay, yes. If it is more than, that is -3, then we can say it is chronic. Moderate malnutrition, acute. Okay, yes. Now it is clear. Okay, fine. That is the point you should note. Where we left? Yes, here the point. Again I will repeat, weight for height. Okay, weight for height and age is there. Okay, weight for height and height for age. This indicates shunting. Okay, age for weight, this indicates wasting, and height for weight also indicates wasting. It indicates shunting. Okay, easily you can remember. WHA, this comes under wasting, this comes under, that is height for age comes under shunting. Okay, whether it is acute or chronic, that we should point. In height for age, we can say that is always chronic malnutrition with severe or moderate. That is the point you should note. This time your question will be coming from here, and I predict that underweight might be your important point. Please make sure that this is your high heel point. Okay, yes. Wasting age, correct. Wasting will be age. Yes, correct. Height for weight, age for weight also can indicate. Okay, only height for age will indicate shunting. Okay, yes. Is it clear now? Yes. Now tell this question, which of the following defects shown in the image? This is easy question. Repeated question. Yes, it is anencephaly. Meningomyelocele, there will be airy growth in the spinal region. There will be a elevation, you can see. Okay, protruding of the spinal canal will be seen there. Okay, protrusion will be there, and you should, what is the management? You should cover with saline gauze, sterile gauze, you should cover with it. Okay, yes, because nerve supplies are going there, you should make the thing correctly. Always remember, they will focus on the nursing aspect. They will focus on only nursing aspect. Think accordingly and answer whether first informing to the physician will be feasible or first management is feasible. In that situation, think on the patient aspect, whether the patient will be safe while informing the physician or taking action is necessary. Like that, you should think and answer according to that situation. Okay, one point I remembered, I told you. Okay, yes, hydrocephalus, bossing sign will be there. Okay, that is one of the important point, bossing sign. Yes, correct. Now tell me, feeder given image in the, what is the feeder name? It is easy to answer now. Yes. Yes, osteoarthritis also we will cover with saline. First we have to, what position you have to give. In that time you should give, not it's like supine position we can give. After that we have to cover with cause. That is the important point you should note in this. Okay, like distance and efficiency we have seen now, like that. Okay, yes. Yes, Haberman's feeder. The answer is feeding infants with cleft tip or palate. Yes, Haberman's feeder. What are the important points you should note in cleft lip and cleft palate? Okay, after the surgery, okay, after the surgery, avoid crying. Positioning is very important. Prone we can give, elbow restine, okay. Then what and all we can do? And spoon feeding also can give with rubber coated spoon feeding also we can give. Okay, yes, correct. Now tell this question. A full term newborn presents with skin lesions shown in the image, second day of life. The lesions are erythematous macules and papules with center pustules, primarily on the trunk. They are telling on the trunk. The baby is otherwise active, feeding well, and afebrile. Very important point, afebrile. What is most likely the diagnosis? They are asking Navinus simplex, no, not at all. Erythema toxicum we can keep, and milia, no, and transient neonatal pustule arm milios we can keep this also. Either A, either B or D. So I have applied elimination criteria because these two are mostly correlated, because I am having confusion in this question. Which will be the answer? Okay, I am having confusion whether B will be the answer or D will be the answer. So I applied elimination criteria here. So what is the elimination criteria I applied? I have removed first option and third option will not be there. Okay, now tell me the answer now. So in this type, there are 50% chances B will be the answer or D will be the answer. Sir, if this question comes, what I will do? Okay, I will see in this section I have attended more than 15 or not. If I attended more than 14 or 15, then I will leave this question. I will not attend this question. I will leave and come, because there are 50% chances this will be the answer or this will be the answer. Okay, don't take risk. So now the answer is B, that is erythema toxicum neonatum. See, in this transient neonatal pustule, there will be fever will be there. They are given afebrile, feeding it is taken. Okay, baby is taking feed well, baby is active. Okay, yes, yes, like SATA questions. Yes, definitely. Okay, this transient neonatal thing, so pustules at birth, here this erythema toxicate, that is toxicum neonatum, we have to treat with antibiotics, but it will rupture. In this thing, pustules are formed, pustules will rupture, then pigmented macules will form. They are benign and it resolves within 2 to 3 months. It resolves within 2 to 3 months. It's a new point. Okay, new point. Please take notes of it. Okay, transient neonatal pustulare milanus. Okay, pustular milanus. Yes, correct. Yes. Sorry if my pronunciation is wrong. Pustular melanosis. Pustular melanosis. Yes, correct. Am I right? Yes. Yes. Thank you. Thank you all. Yes. Thank you. Which event is observed on February 10th for the National Regiment? February 10th is observed as yes, National Deworming Day. World Health Day celebrated on 7th April. What is International Literacy Day? It is celebrated on 8th September. Very, very important question. Please make a note. This might be your question. This might be your question. And International Children's Day is on 1st June. Don't write 14th November. Okay. 14th November is India will be celebrating as Children's Day. Our Nehruji's birthday. Yes. Literacy Day. International Literacy Day is September 8th. Recently we have done. Okay. Next question. A 20-year-old child is brought to the clinic. Okay. 20-year child brought to the clinic with leg deformity shown in the image. The child has delayed walking, frontal bossing is there, and widening of wrist with vitamin deficiency. They are given the image. Most likely responsible for this condition. Okay, delayed walking they told. Delayed walking they told. It is easy. Vitamin C deficiency. In adults, it causes osteomalacia. In children, it causes rickets. Cause rickets. Yes, it is vitamin D deficiency. Vitamin A deficiency, night blindness, xerophthalmia, and keratomalacia, and Bitot spots also. Okay. Vitamin C deficiency, you all know scurvy, bleeding gums, poor wound healing, petake will be there. Vitamin D rickets. Vitamin K deficiency, bleeding disorders will be there. Coagulation defects. Okay. Yes. Is it clear? This question? Cholecalciferol. Yes. Yes, this condition. In classical symptoms of Kawasaki disease, such as fever, conjunctival infection, rash, which of the following is uncommon but potential complication they are asking? It is an medial artery disease. Irfan, please convey your message in English. मेरा हिंदी में थोड़ा थोड़ा में मालूम. Okay, so don't mistake me. Yes, it is coronary artery aneurysm. That is possible. What is the classical symptom? Pain will be there. Okay, and if it is ruptured, you can see hypovolemic shock symptom. Okay, these are important point. Pain in the back or abdomen, there will be there. Yes. Yes, correct. Where it is? Yes. Kawasaki disease, rash. That is the symptom. Conjunctivitis, first thing. Rashes will be there. Adenopathy, there will be lymph node involvement will be there. Strawberry tongue, another one condition which is having this strawberry tongue. Can anyone tell which is the another one condition? Anden's feet will be swelled and burns will be there, which will be more than 5 days of fever. Okay, that is Kawasaki disease. Especially it affects in children. Yes, another one condition is there, strawberry tongue. Yes, scarlet fever. Scarlet fever is the answer. Yes. Thank you so much, Sugant. What type of resistance is used in child who has undergone cleft lip surgery? Already I have told the answer before the slide itself. Yes. Don't ask, they will not give both the conditions. They will give a strawberry tongue option. They will not ask, give this both the condition. Either one will be there. Okay. Don't worry about that. Yes, elbow restraint. Correct. Yes, it is correct. Now we are going to discuss some points later to this restraints. Jacket restraint arm movements will be done from with the vest. Okay, from the vest in the sense from this their arms are like movements are restricted. Elbow restraint stops bending of elbows from here to here will be having the restraint. Mitten restraints especially for neonates and to prevent scratching. Okay, wrist restraint. Okay, restraints that is wrist and arm no movement, that is wrist restraint here. Okay, for patients like psychiatric patients and all we'll be doing in ICUs, we will follow this wrist restraint. Okay, yes. Next question. A newborn has Apgar score of 3 in 1 after birth. She should be the nurse's immediate priority is 3 is the score at 1 minute. It indicates what? Severe respiratory distress. Yes. Okay. Perform full physical assessment. Initiate breastfeeding. That is begin immediate resuscitation with bag and mask ventilation. Transfer the newborn to the mother's chest for skin to skin contact. Okay, because it indicates severe deterioration 3 at 1 minute. Okay, what is the maximum score? If it is above 7 to 10 then it is normal. 8 to 10 is normal, I think. Yes, 8 to 10 is normal. Because it is 3, it is severe respiratory distress. Then we have to begin resuscitation. What is the neonatal resuscitation here? 3 is to 1. 3 is to 1, that is the ratio, and 15 is to 2. Sorry, that is for infants, right? 15 is to 2 is for infants, and 30 is to 2 for adults. If infants, 30 is to 2 if single rescuer. And now tell me, what is the methods? We are having 2 finger technique, 2 finger and 2 thumb encircling. 2 finger technique can be implemented in single rescuer. Single rescuer. 2 thumb encircling technique can be implemented in 2 rescuer. Okay, yes, this is the important concept. What if the patient is intubated? Then it is, we have to give compressions continuous. Compression should be continuous. Every 6 seconds, 1 breath. Every 6 seconds, 1 breath is indicated. And for neonates, brachial pulse is indicated. We have to check with brachial pulse whether the neonates attained ROSAC, that is return of spontaneous circulation, is attained or not. We have to see that. Then what is the important point here? Again, anything else? Yes, I have discussed compression continuous over 6 seconds, that is 1 breath. Okay, yes. Okay, that is the important point I want to discuss you here. Okay, yes. Next question. A mother reports that 2-month-old baby has been crying excessively despite feeding and changing. What should be the nurse priority intervention? 2-month-old baby has been crying excessively despite feeding and changing is there. So what is the thing you have to advise? Advise the mother to stop breastfeeding temporarily. Assess the baby for signs of pain, hunger and discomfort. Immediately administer prescribed sedatives. Suggest the use of pacifier to reduce crying. Nurse's priority role is, yes, assess the baby for signs of pain, hunger or discomfort, because despite feeding, if the baby is feeding well, then drink, that is consuming the milk properly, then it is fine. Changing is there, then there is a discomfort. First we have to feed that. Okay, we have to assess that. Yes, correct. Yes. A child with hemophilia is brought to clinic with complaints of pain, swelling and limited movement in the right knee. The nurse suspects joint bleeding, that is hemarthrosis. Term hemarthrosis. What is the priority nursing intervention they are asking? Apply warm compress to the affected joint. Encourage the child to walk, prevent stiffness. Administer factor 8 replacement therapy as prescribed. Elevate and massage joint to improve circulation. It is C. See, in this options I have given, it is easy, but in your exam there might be tricky. Okay, there might be tricky. Please ensure that before answering whether this answer will suit the question or not according to the scenario. According to this you have to answer. Okay, you all know hemophilia will be, it is a clotting factor defect. Okay, factor 8 is hemophilia A, B is Christmas factor, factor 9. Okay, factor 9. You all know that's Christmas factor, but according to this situation whether it suits or not, that is the important thing you should note. Okay, yes. Next question, a child with thalassemia, what is the other name for thalassemia? Major is receiving, that is deferoxamine therapy to manage iron overload, that is the antidote for iron, you all know that. Overload from frequent blood transfusions. Okay, which of the following should be the nurse alert as potential adverse event? Adverse event they are asking. Yes, classic hemophilia. Cooley's anemia, yes, or else Mediterranean, that is Mediterranean anemia we can say. Yes, yes, it is correct, that is ototoxicity, it affects auditory nerves. Correct, you're all right? Yes, it is clear. Yes. A nurse, next question, a nurse is carrying a premature born baby at 30 weeks of gestation. 30 weeks of gestation. Which of the following intervention is priority in management of this infant? Encourage immediate full of oral feed, administer corticosteroids for lung maturity, administer live vaccines at birth, place the baby in prone position for sleep. So this is a very easy question. We'll be giving corticosteroids for the lung maturity. Okay, yes, it is easy question. Yes, everyone have answered before I read the question. Thank you so much. Yes, it is easy question. Next question. A 2-year-old toddler is seen playing along other children but not directly interacting with them. What type of play is the child exhibiting? We will discuss all the play, but 2-year-old child will have what play? Toddler play. Yes, beta methazone, dexamethasone. Yesterday only I have discussed, right? Yes. Beta methazone comes first, that is big. Okay, 4 into 2, sorry, 12 into 2, 24, right? Right. 12 hours apart, 2 doses. 24 hours apart. Yes, correct. 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 Yes. Now tell me which play is this? This parallel play? Yes, it is parallel play. But now, children's, you will be having this confusion. Here also will make mistakes, right? Unoccupied play. Here, baby is only 0 to 3 months old. Unoccupied. There won't be any occupied thing will be there. Baby is making movements with arms. They will play from their own body parts. That is body movements. That is unoccupied play. Solitary play 0 to 2 years. Okay, 2 years only. They have given more than 2 years children. Then we can say that is 2 plus years. We can say parallel play. Okay, 0 to 2 years, if the word comes, that is the child is 1.9 years old, or they will give 18 months old. Okay, like that they will give and they will confuse you. What is the solitary play here? When the child plays alone or not interested in playing quite yet. It will not involving peer groups. Here, onlooker play also comes under 2-year-old. If you see a word that is onlooker also, that also fits in this question. When a child watches and observes other child, by observing they will play. Parallel play, what others are doing. When the child plays along a side or near to others but does not play with them, they will observe and they will play, but they will not involve the peer groups. Okay, associative play 3 to 4 years. This and all very easy. Association happens in 3 to 4 years. Child starts to interact with others and start with play. Okay, for example, kids playing in the playground but doing different things. Okay, cooperative play, here comes the coordination. Child play with others as interest, both activity from other side also. Okay, other children also involved in playing. Okay, open ground they will play, that is associative play. If it is cooperative, they will cooperate, that is they will involve the peer group members and they will play. Okay, yes. Sometime confusing, yes. That what I was explaining, we are having unoccupied play. Okay, that is 0 to 3 months. Okay, then comes their solitary play 0 to 2 years. They will ask with months, that is 18 months, 15 months they will ask. Then comes here spectator, that is onlooker play. Okay, spectator, that is onlooker play. You can see, let me check this. Okay, yes, onlooker play. Then comes here parallel play 2 plus years. Parallel play, they will watch, they will play on their own, but they will not involve. They will watch and they will play. Associative play 3 to 4 years, they will involve in the ground, but they will start interact. They won't involve peer groups. But in cooperative play, they will have interaction. They will involve other peer group members and they will play along with them. That is cooperation. It is easy. 4 plus years. The years are very important. The age criteria is very important while you are answering this type of questions. Okay. Yes. Okay, thank you. Next comes the question. A neonate with chronic constipation undergoes rectal examination. After examination, sudden gush of stool will be there. What is the suggestive question? It is easy question. Very, very easy question. Yes, come on. Yes, it is easy. I will not tell. Let others to answer. What this stool, what is the intussusception? What will be the type of stool? And Eisenberg's disease is the answer. Okay. Yes. Yes, correct. In intussusception, there will be, yes, there will be current jelly like stool. Current jelly will be here. Okay, ribbon like stool will be there, right? Ribbon like stool will be there in Eisenberg's disease. Current jelly like stool will be in intussusception. Yes, telescopic glove sign seen in intussusception. Advanced study, this and all advanced points you are giving, but try to cover with basics. They will ask from basics, then they will go for advanced. Okay, first we have to clear in this basic concepts, then you can read some advanced points. Yes, correct. Yes, learning advanced thing is not I am not telling it is a bad thing. It is a very, very good thing, but we have to strong in our basics. Foundation is very, very important, because most of the questions, okay, 70%, if you see the question paper, it is only from basics. They will twist from basics and they will give. Okay, previous year's question paper, if you see, there is chronic constipation. On rectal examination, there is ribbon like stool. The baby's stool is like ribbon like stool. Then we will go for Eisenberg's disease. Easily we will do. But they have given sudden gush of stool during examination. Okay, now it indicates intussusception. Okay, yes. Steatorrhea, yes, correct. This steatorrhea will be there in cystic fibrosis, correct. Fat in the stool. While performing suctioning on the newborn immediately after birth, which of the following is the correct sequence? Neonatal resuscitation they are asking. Come on, put in the comment box fast. This is easy question. Easy, right? M comes first, N comes next. Okay, suction mouth first and then nose. Okay, they will, it is an easy scenario, but whichever the scenario is, if they give on resuscitation, suctioning, especially M comes first, then nose. Okay, yes. Next question, which of the following is an contraindicated for administering DPT vaccine to an infant? Okay, yes. Mild fever at the time of vaccination, family history of seizure, history of inconsolable cry after a previous dose, history of encephalopathy within 7 days of previous dose. So this is advanced thing. First oropharynx, then nasopharynx. Yes, Milan, good, very good, very good, very good. Melness trick, yes. Yes. You guys are making fun, right? Only 2 days are there for the exam. Okay, no need to worry, no need to be very anxious. We all learned everything. Enjoy the journey, enjoy the learning process. Definitely one day you are going to clear. Okay, definitely, because we are all nurses, right? We are all nurses. You are the nurses, I am also a nurse. We are proud towards the profession. One day we are going to clear and we are going to have a place in the nursing profession. Okay, believe on that and work accordingly. Yes, correct. Yes, it is D, history of encephalopathy. Yes, correct. Now tell me, DPT vaccine is given. Okay, on the first dose has been given. During the second dose of administered, in the first dose, the child has symptoms like fever, irritability was there, and patient had crying, prolonged crying is there, and feeding not taken for 1 week probably. What is the second dose you will give in this type of patient? For DPT second dose, we are going to give DPT second dose, right? In this type of patient, which we will be giving? In this type, we will give only D and T. Okay, pertussis we will leave. This might cause some sort of reaction towards the child, so that we are not going to administer this DPT Instead of that, we are going to administer dt. Okay, remember this very important point. A newborn is brought to the emergency department with complaints of drooling, coughing, and choking. During feeding, what is most likely cause? Yes, only dt. Yes, correct. Yes, now tell me this answer. Okay, sorry, the answer is given. Okay, it is given tracheoesophageal fistula. It is easy, but drooling is given, coughing is given, and choking is given. Okay, tracheoesophageal fistula, there will be, okay, we have to do suction also. Suctioning is given, prolonged, profuse secretions will be there. Secretions will be there. Okay, yes. Pyloric stenosis, projectile, vomiting. Metabolic, alkalosis, potassium loss, okay, muscle cramps. And in ECG, inverted U wave. This how you should study. We are relating one condition, all points should come, you should involve medicine too. Okay, then you will be answering. Okay, sir, OBC questions. See, in valvular hematoma, what was the scenario here? Valvular hematoma, they have given 24 hours, symptoms are there. They have given indirectly, they have told symptoms are there. Assessment is done. Then ice pack application is must. First priority is pain. Pain is there means already pain assessment is over. If assessment is not over, then vital signs will be the answer. Vital signs will be the answer if assessment is not done. If assessment is priority, then go for vital signs. That is the answer. What is the scenario here? Valvular hematoma within 24 hours. They are given pain is the first thing. Pain, we have to underline that. First ice pack application, then we can do everything. First is always assessment is over. If assessment is not over, then vital signs. Fifth vital signs is pain, right? Then pain is done, then we are going for ice pack application. Okay, yes. See, I am sorry because this is for all over India students. Okay, Hindi I cannot able to explain. Very sorry. This is for all students because students from south, west, everybody they are watching this video. I have to deliver this content to all over India students. Okay, please make sure and please be adaptive towards this session. Yes. Yes. Yes, this was discussed. Correct. A pediatrician prescribes oxygen therapy to a child with heart failure. Heart failure when you have oxygen support to this child. Heart failure, there will be RAS, renin angiotensin aldosterone system will be activated. There will be potassium loss will be there or not. Okay, that we should underline. First, depends upon the situation, which is the priority action. Use diaper change, okay, during sample collection for electrolyte imbalance when the mother is holding the child during sleep. Yes, because pediatrics children during heart failure is there will be decreased cardiac output. So if cry is increased, overload to the heart will be there. So we should avoid cry, but the child will cry. To compensate that, we are going to give oxygen support. O2 we are going to give. Okay, during sample collection we are going to give. Yes. Weight for height. Now comes the point. The weight for height. Weight for height score -2 SD indicates. Now tell me if you understood that slide. Now you are going to answer correctly. -2.5 SD. Now you are going to answer weight for height. Whether it is mild, severe, moderate, severe shunting. Now tell me, dears. minus 2.9 SD. See, minus 2 to minus, if it is greater than or equal to 3 SD. If it is greater than 3 SD, then we can say. Now tell me which will be the answer. Yes, already I told it is moderate wasting. Why you are confusing? If it is between minus 2 and minus 3, it is moderate. More than 3, then it is severe. Okay? Yes. Don't confuse with severe wasting. Severe wasting is more than minus 3. If the word comes more than minus 3, if it is minus 3 also equal to, okay? Yes, I will explain this slide once again. Okay, we will go back. Okay, where is the slide? Yes, here. Here you can see what was the question? Weight for height. Okay, weight for height is what? Weight for height is here. You can see here. Okay, weight for height is here. Okay, minus 2 to minus 3. It is moderate malnutrition, you can see. Okay, it is moderate malnutrition, you can see. Okay, yes, here you can see it is a moderate malnutrition. It is correct. Yes, if it is Z score is okay minus 3 as the severe malnutrition is there. Okay, minus 2 to minus 3 SD. If it is given only 3 SD, then it is severe malnutrition. Okay, yes. Just give me a minute. Now tell me the answer. Next question. A 10-month-old baby with moderate dehydration is admitted in the pediatric unit. What type of intervention should be taken by the nurse? Now tell me, 30 ml fluid is the first hour, 70 ml in the next 5 hours. That is for severe dehydration. 30 ml first 30 minutes and 70 ml in next 2.5. That is second half. Second half we can give. 75 ml kg over 4 hours because moderate dehydration they have given. Moderate dehydration they have given. So it is C. Okay. This is first half severe malnutrition. This is second half. Okay. This is for moderate malnutrition. Okay. Yes. This is for some dehydration. We can give 50 ml kg over 24 hours. Okay. Yes. It's clear? Yes. A option, yes. Severe dehydration, yes. A option is for severe dehydration. 30 ml fluid in the first hour, 70 ml in the next 5 hours. According to the weight. Okay, weight we are going to calculate. 30 ml per kg. Yes. Which of the following is not a major criterion for the rheumatic fever? Yes, tell me. Not a major criterion for rheumatic fever. Carditis, chorea, arthralgia, polyarthritis. See, before that, we have to know what is the major criteria and minor criteria. So I have given the slide. John's criteria we are having, which is having joint involvement, whole look like CR, that is myocarditis, inflammation of the myocardium. Nodules, subcutaneous erythema marginatum, and Sindemans chorea, that is John's. Here, minor criteria are CRP is elevated, normal is 2 to 6 or 8 we can say. Arthralgia, pain will be there, fever, elevated ESR, that is erythrocyte sedimentation rate. Prolonged PR interval, what is a normal PR interval? Come on. What is a normal PR interval? You have to comment this box. Then anomalies of rheumatism and leukocytosis. These are the things. And two major criterion, or we can take one minor criterion plus two minor criterion. One major, two minor. Okay. Yes. This is throat culture growing with group A beta hemolytic streptococcus. Okay. Or elevated antitrypsin O titers. This is very important point in rheumatic heart fever. Okay. Yes. Zero point 122 0.20 seconds, that is PR interval. Okay. Yes, it's clear. Yes, thank you so much. Two major criteria we can take. Okay, this is the major criteria. Two major criteria we can take, or one minor criteria with, okay, one major, that is one major criteria with the two minor criteria we can take. Okay, either this two indicates the positive things, either 1 2 3 4 5 is there. Minor criteria we are having, that is KEF-PAL. This is the mnemonic, that is C for CRP, A for arthralgia, F for fever, E for elevated ESR, P for prolonged PR interval, and A for anomalies, that is of rheumatism, L for leukocytosis. Always remember, dental caries or previously patient having any dental problem, it indicates rheumatic fever. Okay. Okay. Yes, this gas, that is group A beta hemolytic streptococcus, can go and occupy in the mitral valve and forms a protein. Okay, it attaches to the protein and it indicates rheumatic fever. Okay. Yes. Is it correct? Fast. So please children, we are having some more 20 questions are there. We have to be very fast. Okay, this is a revision class. I hope you all understand. Okay. A toddler consistently refusing when asked by his or her mother to put toys away after playing, often saying no. This behavior primarily exemplifies what? Yes, answering in millisecond is very important. That is 120 to 200. That is very important. You guys are studying very advanced. Yes, I am very happy for that. Hopefully all will clear. Okay, these people who are in live, I think this 42 will clear definitely. Okay, be confident, be chill. Okay. Yes, don't have any distractions, have some revisions and go through some important concepts, then go for the exam. Yes. Now tell me, yes, it is B. Temper tantrum will not be there. Suppression anxiety only for this infants. Next question, which nursing intervention is contraindicated in children diagnosed with Wilms tumor? Yes, come on, tell me now. Contraindicated with diagnosis of Wilms tumor. Monitoring blood pressure, administering chemotherapy, palpating the abdomen, measuring abdomen girth. Yes. In this question, easy, right? We should avoid palpation. It will cause rupture of this tumor. Okay. Yes. Rupture of tumor is possible. So we should avoid palpation. Okay. Yes. So how you are going to treat these questions? So we have discussed 50 plus questions, or now we have under 38 questions we have discussed. From this, you can see what are the topics you should cover. So previous year question paper, what are the topics you should cover? So these are important concepts I have told you. Apart from that, if I told measles, read bumps. Then pertussis DPT, the for diphtheria sheik test will be there. Pertussis under day cough. Like that, you should learn all the things. Okay, and some important concepts related to fetal circulations and anatomical parts like sutures in the skull. Everything you should learn. Some important topics alone. This is very high heel. After that, you have to revise some important concepts. Okay. Yes. Next question. According to rule of 5, in Burns assessment for infants, what is the TBA assigned to the head of neck? Okay, head and neck. I will be side, so I will hide the image. The image is given. Now tell me. Yes, correct. Yes, it is easy, right? Rule of 9, if we take, that is of this point. If it is rule of 5, then it is 20% head and neck is covering. And front is the anterior portion for adult. Rule of 9 is 18. Here front is 18. 20. Sorry, it is 20. Posterior part, that is 18 in rule of 9. It is 20 here. For arm, it is here we can say 4.5, 4.5, or this side 4.5, this side is 4.5. That is the anterior and posterior I am telling. Okay. Yes, it is rule of 5 is 10%. Okay, 10%, and legs is also 10%. Okay, if you add this 60, 80, 100. Okay, now you got it point. Yes. Answer already given. Yes. For you people only I given the answer. Yes, right. What dietary modification is often recommended for infants diagnosed with GERD? Yes, that is gastroesophageal reflux disease, which will be there. Diluting the formula with extra water, providing smaller, more frequent feeding, possibly thickened, positioning the infant flat after feeding, using nipple with a faster flow rate. No, we should not position the infant immediately after feed. And diluting the formula, no, it will cause again reflux. Using nipple with faster flow rate we should not give, right? Yes. Providing small frequent meals. After that, make the patient in semi-folded position or folded position. After upright position you should keep. Then after half an hour we can make them lie, but not for infant. Infant we should burp. Okay. Yes. Wide pulse pressure. For infants we can burp, right? For GRD we can burp or not? Yes, you are all correct. Shalu, Shakti, Tamil, Mari, Milan. Yes, correct. Yes, now tell me. Wide pulse pressure is characterized hemodynamic finding in which of the congenital heart disease, heart defect? Wide pulse pressure. Okay. Back to this question. Back to the question where it will be easy question. Yes, it is patent ductus arteriosus. Along with this we'll be having missionary murmur. Missionary murmur. Carry Coombs murmur. Carry Coombs murmur. Austin Flint. Austin Flint murmur will be seen in. Carry Coombs will be seen in. Yes, continuous missionary murmur will be seen. Carry Coombs murmur, Austin Flint murmur. Carry Coombs murmur will be seen in which condition? Carry Coombs. Yes, fast. Yes, come on. Caricum's murmur. Fast, fast, fast. Time is running. Caricum's murmur, aortic regurgitation. Austin Flint murmur, rheumatic heart disease. Okay, rheumatic heart disease. Okay, please refer this. No, no, no. I have told this like ulta, so that I referred. Okay. Caricum's murmur will be seen in rheumatic heart fever. Sorry, Austin Flint murmur, aortic regurgitation. Aortic regurgitation. Austin Flint murmur, Caricum's murmur. Okay. Pansystolic murmur will be seen in ventricular septal defect. Yes, correct. Okay, this is a new learning. Please refer, that is Caricum's murmur, rheumatic heart fever. Austin Flint murmur, aortic regurgitation. Okay, new thing. Please remember this point along with this. Okay, don't confuse. I don't want to confuse you people. Okay, yes, patent ductal sarcoidosis clear. Yes. Okay, that is holosystolic murmur also we can say. ASD will be having S1 split. I forgot to say, it is having fixed S2 split will be there, not widened pulse pressure. This tetralogy of Fallot, boot shaped heart will be seeing cyanosis, decreased pulmonary flow and not widened pulse pressure. Okay, yes. Which of the following is most common complications of epispadiasis surgery? Epispadiasis surgery, come on, tell me. Which of the following is most complications of epispadiasis surgery? C, I think. Okay. Here, epispadiasis surgery they have given. Okay. Most probably there will be urinary incontinence, epispadiasis. Okay. There will be urinary incontinence will be there. Ischemia will not be there. Persistent chordae also will not. This is not related to this condition. Urethral stricture is possible, but most common complication if they ask, that is urinary incontinence. Okay. Yes. Match the following of neonatal reflexes on their responses. Okay, come on, tell me. Yes, come on. Previous question, there is no doubts, right? Epispadiasis, hypospadiasis, you all know that. Okay, yes. See here, there is a only urinary incontinence, most common they are asking. Okay, late complications we can say urethral stricture is possible. See, in epispadiasis there will be a, consider this is the penile region. Okay, penile region. There will be, in hypospadiasis there will be dorsal, that is the lower segment will be affected. Here the urethra will be here, that is epispadiasis, dorsal region, the upper portion, there will be stricture will be there. So in this region, there is urinary incontinence after surgery also. Most common complications episodic surgery is epispeda, that is urinary incontinence is possible. They cannot able to urinate frequently. That is urinary incontinence is more prominent there. So that A is the most common complication. Late complications we can choose urethral stricture. Okay. Yes. In this question, Balbinkini sign, easy. That is flexion of, okay, big toe, dorsiflexion and fanning of other foots. Okay. Balbinkini with for this. Rooting reflex. Okay, let me Moro reflex, placing of placing an object in the arm, palm, resulting in instinctive grasping. That is what? Rooting reflex or palmar reflex. B is like, let me see, yes, 2 for 1. That is rooting reflex. Turning head towards the stimulus, opening the mouth. Moro reflex, jerking movement. Okay, Moro reflex is jerking movement. What indicates 3 for 3? Yes. Abduction of the shoulder and extension of the elbow. Okay, sudden jerky movement also we can say. Palmar reflex, placing an object, grabs the mature pincer grasp. Mature pincer grasp will be in which month? Come on, tell me. Mature pincer grasp. Yes, it is over. Correct. A is the answer. If this type of question comes, yesterday I told you, don't attend in the first half session. 9/9 criteria. You should apply 9/9. Hello, check. Yes. Now it came, sir. Yes. Sorry. Yes. Sorry, children. Sorry, students, for it's a technical issue. Yes. Okay. Yes. About after tonsillectomy, a child begins with vomiting. What is the important points? Already we are running out of time. We have to complete. So I'll be fast. Please come along with me. Okay. Yes. What will be the answer? Yes. After tonsillectomy, we should address there will be bleeding. So if bleeding, blood vomiting is there, okay, hematemesis is there, then obviously the nurse should turn the child to prevent what? Aspiration. To prevent aspiration, we have to turn the child. Okay. Yes. Tuck. Now it is clear. Okay. Yes. The nurse provides instruction to the parent of infant diagnosed with GRD. Which instruction should the nurse give to the parent to assist in reducing the episode of emesis? Episode of emesis. Okay. Provide less frequent larger feeds. No. Less frequent larger feeds will give. Okay. Burp the infant less frequently during feeds. Thin the feedings by adding water to the formula. Thicken the feeding by adding rice cereals to the formula. So we should not burp the infant less frequently during feedings. After completing the feed, we can burp. Okay, that's what the question I have asked earlier. Thin the feedings. No, we should not thin the feeding. Now the answer is thicken the feedings by adding rice cereals so that it will reduce the induced, that is regurgitation, it will reduce. Okay. Yes. Yes, correct. Next question. A pediatrician prescribes a IV solution of 5% dextrose and half NS is hypotonic with 40 milliequivalent of KCl for the children. With hypotonic dehydration, the nurse performs what priority assessment before administering the IV prescription? Now tell me this. Okay, KCl is there. Okay, hypotonic dehydration. Whether the child attained priority assessment we should do. Yes, always remember, check the amount of urine output. IA chart, intake and output chart is must while managing the patients with dehydration. Okay, yes. Assertion and reasoning. breast milk as milk, that is, sorry, breast milk as iron. Breast milk doesn't contain iron. We need to give supplementation iron to the baby. Whether both assertion and reason are true, the reason is correct, explanation for the assertion is wrong. Both assertion and reason are true, but the reason is not the correct explanation for the assertion. Assertion is true, but the reason is false. Assertion is false, but the reason is true. But assertion and reason are false. If this type of question comes, please make sure it will be time consuming. Apply in the second half of the session. Okay? Yes. What will be the answer? Yes. Assertion is true, but reason is false. Okay. Breast milk as iron. Then why does we need to give iron to the baby supplementation? Okay. Yes. Assertion is false. Assertion is true. Sorry. Assertion is true, but the reason is false. Okay. Yes. Breast milk as iron. Right. Bone marrow aspiration is performed in the position for posterior superior iliac crust. What is the position we are going to give? Okay, yes. What is the position for this? No, supine position is not there. Nietzsche's position, no, we shouldn't. We see it is done in posterior superior iliac crust. Iliac crust. Yes, it is lateral decubitus position. Yes. Okay, lateral decubitus position. In during the bone marrow aspiration, what are the complications you can assess? Bleeding and symptoms like bradycardia and hypotension is possible. Okay, bradycardia, hypotension is possible after bone marrow aspiration. Important point, please make sure. Next question. A patient with laryngotracheal bronchitis, child with cool mist tent, but the child is frightened, constantly crying and trying to climb out of the tent. Which of the following is done in this situation? Yes. Allow the mother to be with the child, provide cool mist direct to the mouth, provide toys play, and both A and B. In this type of question, allow the mother to be with the child because child is having laryngotracheal bronchitis. Okay. Other name for this is what? Yes, it is A and B. Allow the mother to be with the child. It is group. Correct? Yes. Group. A newborn has suffered from brachial plexus injury during the delivery. Which of the following will be affected? Now tell me. Newborn has suffered brachial plexus injury. Which of the following to be affected? Brachial plexus injury, then there will be upper limb movement, there will be affected. Upper limb movement will be affected, right? Upper limb movement will be affected. Yes, it is correct. Now comes the questions. Okay, another 10 questions. It is a high yield questions. This might be a question. Okay, length of the baby doubles by what age they are asking. Okay, birth weight doubles at, triples at, height doubles at, and half of weight achieved at, half height achieved at. Okay. Then weight triple set. The length of the baby doubles by what age? Length doubles at 4 years. For example, 50 to 55 centimeter is the normal newborn height. The height doubles at 4 years. 100 centimeter, the child achieves at 4 years. Easy question. Weight doubles at 6 months. Triples at 1 year. Height doubles at 4 years. Half of the weight achieved at 2 years. Okay, 2 years. This is the important points you should note. Okay, yes. Answer is D. Next question. When does the parachute reflex disappears? Parachute reflex will disappear or not? Now tell me, it is easy. Parachute reflex will not disappear. Now it is audible. Yes. Yes. Sorry for the network issue. Yes. Which assessment finding in the neonate should the nurse recognize as the potential indicator of co-articulation of aorta? Co-articulation of aorta, there will be which? There will be co-articulation of aorta. You can see there will be decreased blood flow to the arms and the legs, right? Decreased blood flow will be there to the lower arms. So there will be bounding pulse will be there. Bounding pulse in the arms and absent pulses in the groins and legs. That is the hallmark sign for this condition. Okay. Yes. Yes. Answer is D. Which of the following pairs of gross motor development milestone and the age at which child generally develops the milestones is wrongly matched? Rides a tricycle at 3 years, walks up and downstairs 2 feet at 18 months, yes, hops on 1 feet 4 years, skips at 5 years. I think riding a bicycle is at 5 years, I hope. Okay, riding a bicycle will not be there. Yes, answer will not be walks up downstairs and 2 feet per step, 1.5 months. Yes, B will be the answer. Rides a bicycle at 3 years, it is correct. Okay, hops on 1 feet is correct. Skips at 5 years, it is correct. Okay, don't be confused. Walks up and downstairs 2 feet per step. It is at, I think, 2 years. 2 years only it is attained, not in 1.5 years. Okay, yes. Here comes the question. 20-year-old child was diagnosed with severe acute malnutrition and was started on treatment. When can the child treatment be considered complete? When it can be complete? There is no evidence of edema for at least 2 weeks. There is no edema for at least 4 weeks. Height for length reaches -2 SD or higher. Mid upper arm circumference is more than 12.5. Mid upper arm circumference is more than 13.5. Now tell me the answer. Here, there is no evidence of edema for at least 2 weeks. Yes, we can take. There is no edema for at least 4 weeks. 4 weeks is too long, so we cannot take this. Weight for length reaches -2 SD or higher. Okay, we can keep. Mid upper arm circumference is more than 12.5. Yes, we can take. So either we can choose 1 plus criteria. If criteria is 1 plus, either 3 or 4 is met. If criteria is 2 plus, either 3 or 5 will miss. Okay, okay, this 3 or 4. Okay, D will be the answer. If criteria 1, okay, there is no evidence, then it suits with 3 and 4. That's what the answer tells us. Okay, yes, D will be the answer. Yes. A child has been diagnosed with iron deficiency anemia. Iron deficiency anemia will be having what? Microcytic hypochromic. Certain changes and observations can be expected during the initial days of treatment. On the 3rd day after initiating oral iron therapy, which of the following is most likely to be observed in the children on evaluation? Immediate normalization of the hemoglobin levels, increase in the reticulocyte count, or decrease in irritability, that is immediate improved appetite, replenishment of stores. Which will be the answer here? Okay, when we are administering oral iron therapy, okay, initiating iron therapy, there will be increase in reticulocyte count. That is the important point you should note. Okay, sorry if I am wrong, you just keep past the question and you can answer. Okay, sorry, because there is no time for us, we have to wind up the session soon. Okay, 2-year-old girl was brought to the pediatrician with complaints of repeated hand winging movement and finger-like licking. Detailed history has revealed regression of language milestones. Microcephaly was noted on examination. What most likely the diagnosis is? Okay, it is childhood dyscretive disorder, Asperger's syndrome, Rett syndrome, and Heller syndrome. These are hallmark signs, that is hand winging and movements with finger licking. With microcephaly, if the word comes, that is with Rett syndrome. Rett syndrome will be the answer. Repeated question of NORCET. Then comes here, 4-week-old male infant presents with projectile vomiting, pyloric stenosis. The patients reported wet diapers, thirst, irritability. Examination reveals slightly sunken frontal dry mucous membrane, normal heart rate, prolonged capillary refill for 3 seconds, and slow skin recoil less than 2 seconds. What is most likely assessment of the infant hydration status? There is only some dehydration is there, because sunken frontal slight is there, thirst is there, irritability is there. So some dehydration will be the answer. Sorry. A neonate presents with bilious vomiting and abdomen distension. X-ray shows image given below. What is most likely the diagnosis is? Okay, here duodenal atresia will be double bubble sign. Double bubble. Here you can see 1, 2 and 3. Multiple bubbles. It indicates double bubble with duodenal atresia. Triple bubble sign is with jejunal atresia. Okay, 1, 2, 3. And multiple bubbles also you can see in the abdomen. Okay, this is jejunal atresia. Okay, yes. The last question for the session. 4-month-old infants presents with 5 weeks history of scaly lesions on the face, trunks and limbs. Given image along with the irritability, dehydration and generalized edema, laboratory test reveals hypoalbuminemia and hypokalemia. Based on this, which is the diagnosis? Okay, marasmus will not be there. Plaque paint dermatosis we can keep. Plaque sign will not be there. Acrodermatitis enteropathica we can keep. Okay. Apart from this, which will be the answer? Here they have given scaly lesions in the face, trunk and limbs. Acrodermatitis will not have this scaly lesions like face, trunk and limbs. So B will be the answer. Flaky, that is flaky paint dermatosis. Okay. Yes. These are some important points. Okay. Yes. We are in with the session. All the best for your exam. I hope all will clear. Please analyze these questions and please be keen in your questions while you're answering. Identify the keyword, then correlate with your options, then answer. Very, very best of luck for your exam. I hope all will clear your prelims and as well as mains. We will see in the next welcoming, that is beautiful session upcoming where I planned, and we'll be having lot of MCQ discussion. Thank you all. Have a great day. All the best for your NORCET 9. Thank you all.